It is a huge honor for me today to be podcast interviewing Dr. Marie Samaha of PerioPassion Dental Seminars.com. Dr. Marie is a general dentist who practices comprehensive cosmetic, reconstructive, and periodontal care in a holistic setting. She is a 1982 graduate of the Medical College of Virginia, Virginia Commonwealth University. For well over 30 years, Dr. Samaha has pioneered her practice on the principles of total body wellness through Total Health Dentistry. Her practice maintains a special focus on the advanced non-surgical treatment of periodontal disease and all aspects of the oral systemic link. To support her clinical practice, Dr. Samaha has extensive training in the field of integrative medicine with special focus on advanced medical and genetic testing and nutritional physiology for the purpose of true preventive medicine and healing. After observing a significant disconnect between the scientific research and its application in a clinical setting, Dr. Samaha founded the AGD PACE-approved Perio Arts Institute and began teaching PerioPassion Dental Seminars in 2007. In her seminars, she shares her evidence-based, multifaceted, and leading-edge clinical protocol for the diagnosis and non-surgical treatment of periodontal disease. Dynamic case presentations are also included in her seminar. Her multifaceted approach has enabled her to help transition general dentists, periodontists, and their teams into true wellness-oriented practitioners of dental medicine. I think what you've done is just amazing. It's an honor that you're on my show. One of the biggest problems with dentists, physicians, and lawyers, they always know what they know, but they never think about what they possibly could not know. And I've always thought, whenever you say holistic to dentist, about 90% of them blow an artery and have a stroke and, have this knee-jerk reaction. Yet when you talk to them, they're all holistic. Like if a dentist has high cholesterol, they don't go start taking a statin. They lose weight and start exercising. If they get high blood pressure, they don't take a high blood pressure pill. They change their diet and stop eating salt. So whenever you talk to a dentist, they don't really have any faith in the big pharmaceutical industry, and they talk about their patients with polyphagia, where by the time you're on 5 prescriptions, you're having so many side effects, things are spinning out of control. Yet the same dentist has a knee-jerk reaction against holistic. But I've noticed that dentists who put the word holistic or alternative on their website, it's really the consumers are attracted to it. Would you agree?
Absolutely. And I will tell you, Howard, the kind of interesting story is that in 1982, when I started my practice, I was 25 years old and I came to a town. I didn't know anybody and I started a scratch practice. And it was interesting because on my little, I hand typed my welcome brochure. We didn't have computers and things back then. And on the brochure, I put, "Welcome to the holistic practice of dentistry." And it was so confusing to people. They did not have a clue what that meant. For some reason, it intrigued people. But I think what intrigued people back then, most of all, was that I was a woman dentist. So I got a lot of young families. There were a lot of people who were interested in me simply because I was different, and they thought that I would be better with their children. And so in my early years, about 40% of my practice were little kids. And then as I continued to develop in the area I really wanted to develop and started out in 82, I found myself just, really limiting my practice to adults, and now not limited, but focused more on adults with serious medical complications. So we've just, as my knowledge has grown, you know how that happens. Our knowledge grows, we get beyond ourselves in the kind of things we like to do and what we feel comfortable doing. So my comfort level just increased, and the more I studied integrative medicine and nutritional physiology and all of those things, the more comfortable I felt being with people who were medically compromised and had lots of issues. In the past, I remember as a young dentist, I was so afraid to treat people who had anything more than one medical issue going on. And of course, nowadays we can see people with 16, and it's not unusual for them to have so many layers and they're living longer and so forth. But I didn't want to have anything to do with geriatrics. That just scared me. And, the senior population and all their medical issues. So it's given me great confidence to have that training over the years and to study with different medical specialists and so forth as well, and learn the basics that I needed to know. And one of the basics was just learning how to read blood work, learning how to understand blood tests, learning how to prescribe blood tests. Our periodontal patients are sick. They are sick people for the most part, and most of them don't even know it. And of course, a lot of what's driving their the illness of those who do know it is simply the fact that they have periodontal disease and they've had this chronic disease for so long. So it has taken down their cardiovascular system. Their body is compromised just oftentimes because it all started where the number one area of inflammation is in the human body, and that is typically from the mouth. So it's been very interesting to see this all go full circle, because in 1982, I actually was contacted by the Board of Dentistry and asked to remove the word holistic from my brochure.
What year?
1982.
In 82.
Because it confused the public. And of course, and even many years later, when I began, I'd be interviewed or something for a health journal or something, and they would refer to my practice as holistic or something along those lines. And again, the Board of Dentistry was very unhappy because they found that was confusing to the public. I don't think that I've not had that problem in recent years.
Now, was that the board? You mean your local American
Virginia
Dental Association, or you mean the government state board of dental medical examiners?
The medical examiners in Virginia.
The government.
Virginia Board of Dentistry. Virginia Board of Dentistry.
Well, let me.
And it was Howard. Actually, it was from. It was. I was reported by a couple of, by some local dentists who just really didn't understand who I was. First of all, I was the first female in our region, and I stepped into some territory, and they didn't understand me or know, what that. Remember, that was 34 years ago, and things were different in dentistry back then, and thank God they're not like that anymore.
So let me ask you. Some people complain that America. There's 7 billion people on Earth, only 330 million live here. But some people say, we're 5% of the people on Earth, but take almost a quarter of all the prescription pills. Do you agree with that? When you're studying older sick people, do you think in general, as a rule of thumb, Americans take too many prescriptions?
Oh, absolutely, absolutely. I mean, I think most of us feel that way, don't you, Howard? I mean, most of us in medicine
that's
feel
why
that.
I get so mad when dentists say, some holistic quack up the street. I'm like, dude, you're holistic. You don't take any of this crap.
Do you know what was interesting? You mentioned, the doc up the street kind of thing. In my community, it's been challenging because back in 1996, I believe it was, the American Academy of Periodontology, of which I've been a member since I began dentistry. My dad was a periodontist, a diplomat in the American Academy, and so I was his surgical assistant by the time I was 15. I have been in this a very, very long time, and I love surgery. And in fact, this is kind of an interesting little tangent I'm going to go on, but I love surgery so much that when I discovered or developed the protocol that I use now, I was very, very disappointed because within 90 days of the development of adding on the last layer of what I do and what I teach in the periodontal protocol, within 90 days, I was treatment planning 90% less periodontal surgery. So I was trained in surgery sitting by my dad's side, and he was a, very renowned periodontist, lecturer, clinician, and so forth. And he developed all the internship and residency programs in periodontics back in the 60s, in the early 60s for the armed forces. So I had a great mentor, and he had beautiful, beautiful hands and gorgeous artistic surgeries that he performed. And as an artist myself, I am a painter. I just love the artistry of surgery. And when I realized that the instrument that I added on to my protocol that made all the difference for me was, or kind of put the bow on the package of the protocol, was my CO2 laser. And within 90 days of introducing the CO2 laser into my protocol, I was doing treatment planning 90% less surgery. And that broke my heart because I love surgery, but I could not justify, because of the results we were getting, I could not justify flap and osseous surgery or any augmentation surgeries that I could, when I could do so much. And I mean, even advanced perio patients with, 8, 9, 10 millimeter pockets that we're stabilizing and keeping stable. We're reducing the pockets and keeping the areas stable into the 2 and 3 millimeter range, 1, 2s, and 3 millimeter ranges for the duration, for years now. It's been 11 years that I have, since I implemented my CO2 laser. But prior to that, since 1982, 83, that's when I began introducing nutritional supplementation for my periodontal patients. And that was something my dad had never had any interest in or any desire to learn anything back. Of course, he retired before I started, or about the time I started practice. So, and I'm in another town 3 hours away from him. So once I started dental school, I wasn't assisting him anymore. I was in a different city and didn't have that privilege. But prior to that, I really knew surgery, and I know surgery, and I've taken all the advanced surgical courses I continue to do because I do love that, and do my own implants and grafting and bone grafting, soft tissue grafting, pinhole surgical technique, etc., and maintain that education through the American Academy of Periodontology. Broad range of things to pull from as I'm seeing these sick patients and treating them. But what we also have to remember is that the illness that comes from periodontal disease, the systemic illness, begins in the state of gingivitis. As long as there is a breach in the integrity of that epithelium, the sulcular epithelium, we've got a disease, we've got a systemic disease going on. Because that bacteria that's causing periodontal disease, that anaerobic bacteria, is in the bloodstream. It's actually, invading all 70,000+ miles of vasculature is being infected, and that bacteria is being delivered to every organ in the body, from the brain to the kidney. I mean, I think we all are familiar with the wide range of diseases and illnesses that are related, that have been scientifically shown to be related to periodontal disease, or that periodontal disease is a risk factor in these different diseases. And we start with, heart attack, stroke, hypertension, diabetes, of course. Those are the big ones, but also dementia, Alzheimer's disease, kidney and lung cancer, breast cancer, colon cancer, multiple myeloma, Hodgkin's lymphoma, pancreatic cancer, prostate cancer, oral cancer. All of these things are increased with the presence of periodontal bacteria in the bloodstream. And not only from a direct correlation or direct relationship of those bacteria being found, for instance, in the carotid artery on autopsy of people who've had a heart attack, but also being found in the colon in people with colon cancer, being found in the brains of people with Alzheimer's disease. A tremendous, I think something like 85% of all people with Alzheimer's who were tested in a very, very upstanding study by Judith McCloskey, a physician researcher out of Switzerland, showed that I believe it was 85% of Alzheimer's patients on autopsy had T. denticola and other periodontal spirochetes in their brain tissue. So this is really a very, very serious issue. And not to mention that we have a documented case of a stillborn baby who was infected by her mother's periodontal bacteria, F. nucleatum in particular, that actually crossed the placenta and infected the baby's brain and gut, I believe it was, and actually killed the baby. At a full-term baby was stillborn because of this, and that was the cause of death, septicemia, because of F. nucleatum, which is strictly a periodontal bacteria. So this is no joke, and not to mention the many instances that we know of preterm birth, tremendous amount. 50% of all preterm birth, we have no idea why it happens here in this country. And yet we've got 80 to 90% of the population has periodontal disease in some form. So it doesn't have to be aggressive periodontitis. We don't have to be looking at periodontitis to be imagining that we've got risk in the total systemic system. This is something that happens even in early stages. So we need to be looking and identifying periodontal disease in the very, very, very young children. We are inoculating, especially as mothers, we're the first typically to inoculate our babies with the disease with the bacteria that causes tooth decay as well as gum disease. And we have phase contrast microscopic slides of 2, 3, 5-year-olds who have periodontal bacteria already implanted in their gums, and they have absolutely no sign of periodontal inflammation. There's no gingivitis in these little tykes. This is just simply what happens. And then when hormonal changes start happening, and nowadays that can be when kids are even 7 years old, we start seeing hormonal changes happening these days, and we're then starting to see gingivitis in these little kids that we never saw when you and I were in dental school. So, just educating our children and educating the teenagers and so forth is a really big, important thing in my life. Even though I don't see a lot of children and young people anymore, it's still a really huge part of what I do is increase awareness throughout the country, throughout our state, definitely throughout the country and abroad. In my seminars to physicians and dentists, we've taught. Now you've mentioned how many countries that this is being broadcast in. This is
147 countries.
Well, I have only taught in 7 countries, so I feel like I'm just a little miniature, but thank you for allowing me the honor of doing this podcast and hopefully sharing this with many more around the world, because not only is this information so important for all of us. I mean, if we as dentists and dental professionals don't understand this dynamic, then who do we expect to take on that job? I mean, clearly, this is not something physicians have time to talk about. I do spend an extraordinary amount of time interacting with healthcare professionals outside of dentistry so that we do start connecting the dots for them. They need us. They need us so badly. And it's critical to do that. And I think you're familiar with the American Academy for Oral Systemic Health and what it has done as a grassroots organization started by Chris Kammer. He called the first call, and I was on the first call, 8 of us who stepped up to say, yes, we want to do this, and we want to found this organization. And now we're getting ready for our 6th annual conference in Orlando at the Gaylord Hotel on September 16th and 17th. And I have been very honored by...
What's the date of that? What month?
It's September I want to say, let me check my paper here. I want to say it's the 16th and 17th.
You and I have so much in common, and I didn't know I'm a painter and you're a painter too.
Oh,
I've been
good.
painting hot dogs with ketchup mustard for almost 55 years. And
Oh, God.
hey, so I want to
Plastic dentist loves hearing you talk about that.
I want to ask you some very controversial questions that dentists can't agree on Dental Town. So I'm just going to ask you point blank: is periodontal disease contagious?
Absolutely. I believe it is contagious 100%. Absolutely. We see, and the reason I can tell you that with such certainty, Howard, is because we do DNA testing of our periodontal patients, of their bacteria. And we see almost identical patterns in husbands and wives and even children in the same family.
I
And
wish you would write an article for Dental Town magazine in that. I half the dentists in America do not believe that, and it is so obvious. You
yeah,
see, yeah. Do you think you could ever write us an article on just that? Is periodontal disease contagious?
Howard, I have written an article that's been published for the lay public called "Are You Certified Kissable?" and it talks it's to that. And in fact, we started a campaign in our region called "Are You Certified Kissable?" Campaign, and it really has taken off quite well in the colleges and so forth. And even though they even devoted an entire week to it, and I've designed a button, and all the pre-med and pre-dental students wore buttons all around campus for the week before Valentine's Day, and then I did a presentation the day before Valentine's Day to the campus, and it was really quite enlightening. And we really need to get these kids, before they start having babies, we need to get this information out to them. And even my little kids as patients, I start talking to them about beware, because they need to be really, really clean, so that some girl's going to want to kiss them one day, or that you don't now, you just make sure that I see that girl or boy, or that you're planning to kiss. You make sure you send them in here for a free consultation, and we'll make sure that their bacterial slide is free of the kind of bacteria that could infect you.
I tried to get certified to be kissable, and I was only approved for chimpanzees, orangutans, and gorillas. Um, well, one of the things that I think, I mean, go below the belt. If you were treating a woman every 6 months for an STD, after
Yeah,
10 or 20 years, wouldn't you ask her, I think I need to see your husband? And
yeah.
you go into dental offices and they've seen grandma every 3 months for 10 years, and the office has never even seen grandpa. Does that make
Yeah,
any sense to you?
it's so ridiculous. And in fact, that's how we get our spouses and significant others in the office, and other family members. The American Academy of Periodontology made a statement years ago, recommending that suggesting that if one person in the family is infected with periodontal disease, every person in the family should be tested for it. Every person should be evaluated for periodontal disease. So so I refer to the family unit as a pod of infection. And I learned that from, I believe it was Tim Donnelly. It was a term he used, a periodontist who also speaks. And I really, and that's what I use to describe it to my patients. And so I say, so we need to consider that your family has all been exposed to this. Now, not everybody is going to come down with periodontal disease. Not everybody, even if they have the genetic marker, and we think about 33% of the of the population has the genetic markers for periodontal disease. However, and every layperson in the world understands this if you just explain it very simply. If we think 33% has the genetic marker, but 85% has the disease, what's more important, genetics or lifestyle, environment, nutrition, etc., habits, hygiene habits? And clearly, I have never had a patient not understand that. I mean, never. It is so obvious to our patients, but for some reason, as dentists, we tend to think, we think beyond the practical, the common sense. We go to a different level. And that works against us so many times. And I certainly have been guilty of that. But this just makes so much sense. Just as you said, when you talk about STDs or anything else, get the family in here, get the family. So we offer a complimentary consultation to anyone to come in to see if they are certified kissable, or however they want to say it, or just to say, to make sure that they also are not infected. Because once we start treating you, I tell them, I can get you healthy, I can get you stable, but I may not be able to keep you there for long if you're being reinfected. But I can tell you, even in the presence of your husband or your wife who may be infected, I will get you well through this protocol, but I won't keep you there, because this bacteria is the most aggressive.
And another thing I argue with dentists, these dentists who everything is binomial. It's yes, no, black, white, up, down, left, right. They'll say, no, it's not communicable. And then I respond to them that the oral biologists are discovering a new species in the mouth every quarter. So, I mean, can you imagine what this disease is going to look like 100 years from now or 1,000 years from now? So to be playing God, that you graduated from dental school and you know everything that's going on in the mouth or the human body. I mean, and I found another shocking study. The Journal of Endodontics published a study based on insurance data showing that the endodontist at 5 years had a 95% success rate, but the general dentist had a 90%. So they were only 5% better. So they think they understand it so much more and are probably doing everything so much better. But at the end of the day, it's only a 5% higher success rate. So there's just so much we don't know about why a root canal fails, why gum disease exists, So how can you just say, no, it's not communicable?
Well, and Howard, are you aware of the research that shows that endodontic bacteria can incite cardiovascular disease?
Yes, for periapical lesions.
And we know, absolutely know that bacteria sits and harbors in the bone in the microvasculature in the bone around the apical region, even after the apparent lucency has gone away or the root canal is no longer symptomatic or anything like that. So once it's been so-called successfully treated, we still have bacteria living in that periapical region, and that's still continuing to go through the body, which is why if I have a patient who wants root canal therapy, even though it is the last thing on my list of what I want to do, my preference is to do the root canal therapy myself, because we do not have an endodontist in our region who has a laser, and we do not have an endodontist in our region who has ozone therapy. So we've been certified in the use of medical ozone for several years, and with that and my CO2 laser, I feel very confident in being able to help at least control the periapical bacteria and to help reduce issues of recurrence of active infections, but at least feeling more confident that I've killed off more of that bacteria than we possibly could with traditional therapy.
Which brand of CO2 laser are you referring to?
I use the Luctronics. It's
Spell
a Korean laser, Luctronics. And I think it's by GPT Laser is the company, but Justin Mangelsdorf is the director of education, and he is a fabulous, amazing individual. And I absolutely, when my laser went down recently, because it actually crashed on the floor, and that was our own fault, and it accidentally got knocked over, which is almost impossible to do. I've had a CO2 laser for 11 years and it's never happened, but it was an unusual circumstance. It fell on the floor, and I was without it for a short period of time and almost went out of my mind. I use it all day long. All day long.
Can you spell me the name of that laser again? It's
It's Luctronics.
Tronics. Electronic
And I think it's GPT Lasers is the company.
GPT GPT
Laser.
lasers, and it's out of where? Korea or
It's out of Korea, but I mean, obviously they have their rep is here,
right?
out of Knoxville. But I certainly would be happy to pass on Justin's contact information. He's just phenomenal. I've never worked with a rep or a director of education or anything.
Okay,
But
so why did you go with this CO2 lasers? What are other brands of CO2 lasers or
well, some of them do. Some of them now do the hard tissue. I'm not interested in that. I everything that we do is revisional. It's recurrent decay. It's obviously because I have an older. If I had a pediatric practice, I would be more interested in a laser that has hard tissue capability. I am only interested in soft tissue capability. So for a fraction, literal fraction of the cost of a hard tissue, soft tissue CO2 laser, you can get a soft tissue CO2 laser that is absolutely beautiful and brilliant in its abilities. If I had an opportunity to share the case studies with you as I do in my seminars, it's mind-boggling what this will do. And so much so that, Howard, I really stretch the envelope. I'm a curious person like you. And I never accept the status quo. I'm always looking for other ways and other methods of moving forward and solving a problem. And so it was important to know that using this laser gave me the opportunity to bring a whole new level of care. And when I share these case studies with the doctors and teams when I teach, it's beyond even being able to grasp. And the periodontists are blown away as well, though especially those who've never used any lasers. But the really important thing is that we've got an opportunity to stretch the envelope in surgical care that I might have been hesitant to try. Like, I'm pretty creative, and as an artist, as you are with your hot dogs, as an artist, our artists tend to look outside the box very easily, and so that is not a stretch for me. So I will push into a surgical solution for something that maybe has never even been published before, but I feel very confident that I can use this and do something with it. So I do it, and I know that I've got ozone and I've got a laser in my hip pocket. I'm not fearful that I'm going to make a mistake or that there's going to be a problem. If there is a problem, a post-surgical problem in anything that I do, I never fear. I don't care how ugly, how horrible it looks. And I've had a couple over the years of really heroic things that I wanted to try. And I went out and I did it. And the patient understood the risk, understood my position and what I was doing, and wanted to try. And so we tried, because the alternative was going to be even worse than the attempt to try.
Lisa, in the United States, everyone has heard of a CO2 laser, but really most of the people listening to you are not familiar with ozone. So can you go into more detail about ozone? I assume 90% of the listeners have never even heard of ozone. What is that? Is it a machine? Where do you buy it? Talk ozone.
So anybody who's going to use ozone needs to be officially trained and certified, and their team does too. And we have some wonderful teaching facilities throughout the country, or teachers throughout the country who can do that. I am not one of them. I do not teach ozone. I have it is one of the things that I talk about in my seminar, but I don't teach a course on ozone therapy. That's just not my thing. And so I'm not the best one to talk to you about it, but I can certainly give you names on it. But what I want to say is that it is all natural. It is something that the body manufactures on its own. It is manufactured in nature constantly. It is the scent you smell on freshly laundered clothing hanging on the line outside. It is what you smell after a thunderstorm, after lightning, because the oxygen, it's O3 instead of O2. So O3 is an unstable structure, and it is in its unstable form that it's able to do what far beyond what oxygen can do. So the cells in our body absolutely love ozone. They crave it, and they heal beautifully in the presence of ozone as a gas, as an oil or an ointment, and also in an injection form of the gas. It's been being used all over the world, especially Cuba happens to be one of the leaders in the use of ozone, and so are places like Germany and Egypt and places you couldn't even imagine throughout the world. The United States is about 25 years behind the rest of the world in the use of the rest of the educated world in its use of ozone. And we're trying through the International Academy of Ozone in Healthcare, which is one of the organizations I'm also a founding member of, we are trying very hard to change that. So
who's the leader of ozone in the United States?
Well, we've got people like Dr. Mark Weiser out of California, and San Diego, I believe Mark is. We've got Dr. Bill Domb, D-O-M-B. I trained under Bill.
I've been trying to get him to do a podcast for 2 years. Is he your buddy?
He is my buddy, and I will put the word out. He is in Yap right now, if you know where that is in the world. It is he goes to third world countries, and he shares ozone technology with them. He teaches in the universities.
He's in Yap?
For the use of medical technology, so use of it in when Haiti had the really bad what was it, a tsunami, or I'm trying to remember now, years ago, the horror that happened down there, and there were people who were losing limbs and having amputations and so forth. So Bill went over and actually helped build ozone generators, help them build ozone generators so that they could learn to heal these limbs and these lesions.
So it's the other one was Mark Weiser?
Mark Weiser, W-E-I-S-E-R.
Well, send them both an email and CC me, Howard, at Dentaltown, because every time I've asked Bill, he says, okay, I will next month when I get back from wherever, and he always forgets when he gets back. But I would love. And are you going to go to Cuba now that it's open again to the United States?
Oh, I would love to.
So yeah. I guess they just resumed flights back there, right?
Yeah.
I think that would be so fun to go and connect. I want to ask you a question that
the International Academy of Ozone in Healthcare, the annual meeting was in Cuba last fall. Yeah, this next year, I think in 2000.
So were you able to fly direct from the U.S. to Cuba when you went?
I didn't get to go because I had a conflict. I was teaching a seminar at the same time. So I didn't get to go.
So I want to ask you, you and I are the same age. We've been doing this 3 decades. 3 decades ago, the phase contrast microscope was more popular, and I think it's been a disadvantage that it went away, because when you would take saliva from someone's mouth and then they would see these crazy, it looked like a crazy zoo of a bunch of crazy people. They got religion in a second that there's bugs in their mouth. And I think the phase contrast microscope needs to come back.
Absolutely. It should be part of every dental student's green box. It should be part of it. Absolutely.
And what's the name of yours, and where did you buy it?
I bought it through Bill Landers. He is the expert in this country, absolute expert on phase contrast microscopy for dentistry. And he owns Oratec, O-R-A-T-E-C.
Okay,
and
hang on. O-R-A-T-E-C?
Uh-huh. And they provide all kinds of things for dentistry, but the phase contrast microscope has got to be his claim to fame, and he is the world expert in microbiology in dentistry. So I've learned pretty much most of what I have learned from Bill.
Is he your buddy?
He's a buddy, yeah.
Can you email him and CC me?
I will.
Because you know who turned me on to that? Do you remember Omar Reed?
Yes,
Yeah,
absolutely.
he's a local boy here in Phoenix, and I remember
Yeah,
studying so many days in his office, and he would show the patients those bugs, and they immediately want to do the perio regimen, whatever it was. It just
yeah,
seemed to because our job is not just to diagnose disease, we have to sell it to the patient, or they're not going to get
exactly.
treatment. And that phase microscope, man,
Yeah.
that was the ultimate teacher.
And you know what's interesting is I didn't have the phase contrast microscope until maybe about 8 years ago. So I was doing what I was doing for many years before I had it, and I knew I wanted to get it. It was just another piece of technology to purchase and learn and have, and so it just got put on the back burner. But then finally, as I was in doing my teaching and so forth, I felt it was absolutely necessary for me to have. And I love it. My assistants love it. Hygienists love it. There's patients are enamored with the idea that they can actually see. They saw when they were what it looked like when they were diseased, and they can see the progress that they've made. And when they don't have, when they have a beautiful gray screen with no wiggly things all over it. But what's really scary is when they see the spirochetes. We see amoebas, we see spirochetes teaming up and just jamming themselves in armies onto the blood cells and things. I mean, it is the most dramatic kind of a visual. And it is my segue immediately. I actually can leave the room at that point when I show the slide to the patient. I can spend just a couple of minutes telling them about it. I can leave the room, and my dental assistant has already begun the oral DNA process, the DNA process for getting their bacterial DNA, because it is an absolute, I would say we have probably in 8 years, we've probably had one or two people who have said no to the DNA testing once they've seen their phase contrast slide, because they understand, okay, we see the bacteria, we see the activity level, but we can't give them names. We can say they're spirochetes, we can say they're rods, they're spinning rods, they're clock arms, we can say you have amoeba, but we can't name those bacteria. And until we can name them, we don't know what antibiotic to put you on, because you clearly have a systemic infection. And because you have a systemic infection from this bacteria, because it's gone through your bloodstream, we need to most likely put you on a systemic antibiotic in order to be successful in treating your disease.
And
So,
what are you doing the DNA analysis with?
uh,
I,
with the paper points
I
and
know, but
cell
what company?
what company? Well, I'll tell you, I'm kind of between a couple right now. I will say that I'm going to mention two.
Okay.
Oral DNA through Access Genetics is who I have been using. They have got a broad spectrum of things that they offer. Um, One of the interesting things from Aura Vital out of Canada, that's Jim Hyland's company.
Oral what?
Aura Vital, Vital.
Okay.
So Ravital, is that Jim Hyland, who's a dentist, and Ann Bosey, who
His daughter.
she's got a PhD in oh my goodness, microbiology, I suppose, and has been working with Jim for 25, 30 years in developing what they have. And they have a whole system for treating periodontal bacteria and so forth. But also what they have just introduced, and I am in the process of starting to use, is a system that not only detects periodontal bacteria, but it also detects viral particles as well as fungi. So we're able to see all of those things, whereas the other DNA reports are limited to periodontal bacteria only. And what we know from the current research is that viral particles as well as fungal organisms are also involved in periodontal disease.
So who's the new test with that picks up virus and fungi?
or a vital.
Okay, that's the one. Okay.
Mm-hmm. Yeah.
So at the very beginning of the show, you said that in your journey, you started out with the father, did a lot of perio surgery, and then as you develop your protocol, you got rid of about 90% of your surgery. So tell us about what it was in your protocol that made you go from surgical to non-surgical. What is your periodontal protocol?
Well, and I'm glad you asked, because I have created a step-by-step manual that is very intense, very detailed, and it gives the entire protocol. But I don't release the protocol unless somebody's actually taken the course, because it's a 2-day, pretty intensive course.
And they would find your courses at PerioPassion Dental Seminars.com.
Yes, but I would like to share the protocol. I'm happy to share the steps or the things involved in it. So what we do is we first start out with things like the phase contrast microscope, and we talk to the patients about nutrition. And it's a terminology that I first wrote about in 2004 or 2003. It was published in one of the journals, and I guess I coined the term periodontal nutrition. And because up to that point, there really wasn't anything quite published on it or talking about it. And we didn't have the internet accessible prior to that, where we could really research this stuff. So everything I learned was just from my own personal study in nutrition back in the early 80s. So that's where my study in nutrition began. I got pregnant with my son in 1983, and I thought, oh my gosh, I know I'm pretty healthy and I eat pretty healthy, but I just want to know that I'm doing everything I possibly can. I was the total militant and very, very involved pregnant mom, and I had to do everything perfectly. And so I just started on this journey of studying nutrition myself and learning about what was important to maintain integrity of soft tissue and vascular tissue. And that's how I came up with a protocol to begin my patients on in 1983 or so. I began putting patients on certain nutritional supplements. So I created a little form, like a prescription pad, and I would check off the boxes of the different nutrients that I felt would benefit them. So all of our periodontal patients would go to the health food store and pick up. I always wanted them to have a really good brand. And so that was how I began in developing my protocol, was with nutrition. Then after nutrition came my study in the gut health and integrative medicine and all of the levels of medicine. So I was studying that at the same time that I became familiar with phase contrast microscopy, DNA testing, testing for bacteria as well as genomics, and and then certainly adding in my soft tissue laser. And like I said, when I added the CO2 laser in the mix, that's when I saw incredible advances in how fast patients healed and how stable they remained. So it's a protocol that is multifaceted, and the blood testing is also a very important part of it. And what a shame and how embarrassing that as dentists, we have the title of doctor, but we don't know how to read blood tests. We don't know how to write for them. We don't understand them. Unless we've had some sort of illness ourselves or somebody close in our family, then we might understand what an A1C is, or what a high sensitivity C-reactive protein or CRP is. We might understand a little bit about LDLs and VLDLs and HDLs because we've had high cholesterol. But there's so many things. Vitamin D deficiency. I started doing blood testing on my patients in 2005. And I think I was probably one of the only dental practices in the country doing that. And I just did it because I saw that physicians weren't catching some of the stuff that I was learning and reading from my studies in integrative medicine. And one of the things that I learned was in the 2003 New England Journal of Medicine, there was an article about a high sensitivity C-reactive protein. So in 2003, I had this bug that, so that's an inflammatory marker. It's a C-reactive protein is a protein that's manufactured in the liver in response to inflammation anywhere in the human body. So when that inflammation is there, it doesn't matter where it comes from. It's inflammation, and that marker is going to be increased because of it. So periodontal disease is an incredibly high-level inflammatory disease, and many people, in most people, it is the number one area of inflammation in their bodies. So wouldn't it make sense that if high sensitivity C-reactive protein is an inflammatory marker, that periodontal inflammation would make it go higher and increase our risk for future heart attack and stroke? So I simply said, let's go ahead and test our patients with periodontal disease and find out if we test them and treat them, will their C-reactive protein go down? And lo and behold, it went down. And that's the article I should have published years ago, back in 2005, 2006, when I was researching that. And nowadays, there have been many others who have published in juried journals on that very topic that I have results that date way back to 2005 and 6. But it was just one more article that I never got around to writing. And I've got, if I could do it in my sleep, I would have probably 100 more articles that I would be involved in right now, but it's not in the cards at the moment. So right now I'm putting the finishing touches on my keynote for the AOSH, or the American Academy for Oral Systemics Health's opening sessions. Dr. Sam Lau will be, he's internationally recognized as one of the finest diplomats of the American Academy of Periodontology. He will be beginning the morning general session on the first day, and I will speak right behind him. So how honored was I to be asked to speak on clinical protocol, on my clinical protocol that I developed, and I am merely a general dentist, but I'm very, very pleased to have the opportunity to do that and to be sharing that with the Academy and its members, because we'll have lots of team members there. It's an awesome, awesome meeting. The lineup is without a doubt one of the finest lineups I've ever seen in dentistry. And when you talk about if anybody here has an interest in the oral systemic link, there's no better place to learn. So I'm super, super excited, and registration is still open. So I encourage people to go to AOSH.org. It's AAOSH.org. And check on the lineup. There's been a webinar on the lineup where every doctor who's going to be speaking has been described, everything that they're going to be talking about, everything from periodontal health, wholeness, holistic health, all the way to sleep apnea and sleep disorders, breathing disorders, and so forth. So it's very robust.
So did you say that mean, what was it, ASOP? What was the name of that website?
AAOSH. That's S as in Sam.
AAOSH. And when is that seminar?
It's .org. And the seminar is, the annual conference is September 16th and 17th in Orlando at the Gaylord, Orlando, Florida.
And then the month after that, you're also at Keating Dental Lab, right? November 18th and 19th?
November 18th and 19th, I'll be doing my two-day seminar. Dr. David Hornbrook had offered me the use of his facility for presenting, and he felt that it would be something that would be of interest out there. So we do have a huge number of doctors from California, from Arizona, from Washington State, Oregon. The West Coast, as we might expect, has always been our biggest draw for the PerioPassion seminars. And I'm here on the East Coast in Virginia. I actually prefer to do the seminars here in my own beautiful office. I have a teaching facility here, and it just gives me a chance to share with people how my practice.
I want to ask you a personal question. When I was in dental school, I graduated in '87, and the dentists at that time that were placing implants, they took a brutal beating. They were called quacks. They were nuts. A lot of them was that was back with subperiosteals, ramus bars. They were figuring all this out, and a lot of them, when they had their first major case fail, the local board took their license away. I mean, those 5 years are brutal. I think holistic dentists right now are kind of like implants were in the 80s. How do you personally deal with conservative dentists who basically just don't want to hear anything holistic? And the minute you say holistic, naturopath, integrative medicine, the minute you say even the oral systemic link, they just shut you down, because dentistry is about fillings, crowns, and root canals, and they don't want to hear any of that. How do you personally handle that type of feedback?
Well, I'm going to tell you how I've done it over the years, because about 18, 19 years ago, I began writing on this. Well, actually, it's 1996. I began specifically writing articles for our local publications on the oral systemic link. And the reason I chose that time was because I was at the American Academy of Periodontology meeting out in San Diego that year. And it is when Dr. Steve Offenbacher came out with his research on preterm birth of babies and perio. And it's when Dr. Bob Janko presented his research on and the Pima Indians study. And at that time, it was just amazing, jaw-dropping information. And I remember sitting there with like 3,000 periodontists and a very small number of dental dentists, and just looking at each other like, what did he just say? And what does this mean? We think there's really a connection. We can say there's a connection. So I came back to my community and I wrote an article for our daily press, our local newspaper. And the title of the article was Gum Disease, ... a life-threatening issue, ? And it was a half-page, top of the paper, half-page article. I got so much scrutiny on that. Oh my gosh, I heard from periodontists, local periodontists. I heard from colleagues all over. They sent me nasty notes. They sent me, oh, you quack. How can you dare? Yellow journalism. I mean, everything, the fear, putting fear into people, and this is, so wrong. And even to this day, I still hear some of that. I'm just telling them the facts. But what I've backed up that conversation with is years. Now that's been 20 years of writing articles in my community for health journals, and the local Coastal Virginia magazine is ours. You might have the Phoenix magazine, whatever, and a full-page article every few months on something about the oral systemic link. And I cite research in every one of them. So nobody, now this is interesting. We actually had a local dentist. I wrote an article it was Breast Cancer Awareness Month, and the title of the article was something about, what does breast cancer have to do with periodontal disease? And or something along those lines. And I actually got a call from the president of the Virginia Dental Association, who said to me, Lisa, and he happened to know my dad from years when he was a young dentist and my dad was an older dentist. So he respected me enough to call me himself. And he said, Lisa, I got a call from someone in your community, a dentist in your community, who said that you claimed you could cure breast cancer by treating periodontal disease. Howard, nowhere in that article did I ever even get close to alluding to such a thing. But that is the ignorance of our society. I mean, our professional society on some levels. I'm assuming this was a very much older dentist who reported this. He didn't even read there's no way he could have read the article. If he read it, he certainly didn't comprehend it. Nowhere did it ever say anything about treating periodontal. It said that periodontal disease was a risk factor for many cancers, and breast cancer happened to be one of them. And I cited references in it. So it wasn't like I was just talking out, just making things up. It's always founded, and we have to be very careful that we do that we do cite our references when we do make these statements in the media.
Well, podcasters they're a young people. Most of the evidence on podcasters, they're all under 30. There's hardly anyone our age. doing podcasts. But I posted on Dental Town and my social media the other day, reminding them of that. I'm trying to find it here. That 19 years ago. Remember 19 years ago when Reader's Digest, which
Oh, yeah.
this is before computers and laptops, and Reader's Digest was on every grandma and grandpa's nightstand in America. And they got an amazing one of their journalists. His name was William Eckenberg. And they gave him study models and a full set of x-rays and sent him off to 50 dentists. And guess how many treatment plans he got?
50.
50. So the deal is, I want to tell these dentists that, okay, so your great grandma used a telegraph, your mama used a telephone, and you're on the internet. It's the same copper wire. The telephone is a telegraph 2.0. The internet is a telephone is a telegraph 3.0. And we have never got. There's 211,000 dentists in the United States alive that have an active license, dental license. You couldn't get 211,000 dentists in America to agree that today is Wednesday. So I applaud you to that. I can't believe our hour is up. That was the fastest hour I've ever done. But can I ask you one overtime question?
Yeah.
When
Absolutely.
you were in dental school, when you graduated from the Medical College of Virginia in 1982, how many were in the class and how many were women?
I think we had 120 in our class, and we had about 21 women, maybe.
So that was 20, almost 20%. How many, when you were a freshman, how many women were in the senior class?
Maybe a little bit less than that. But you know what's interesting, Howard? I remember reading a statistic back in 1982 when the year I graduated. This was from the ADA's research. 1.7% of the dentists practicing in this country were women.
So the Virginia was ahead of its time then, because
no, this is what I think. It was practicing dentists. So we were graduating female dentists, but they were not necessarily practicing all the time. They were taking time off to have babies, whatever.
So I want to ask you this: when you were in dental school, did you feel that dentistry was a male profession, and you were an outsider coming into a male profession, or not really? Or back in 1982, did you feel like you were just another dentist?
I knew I was in a primarily male profession because whenever I would go to a meeting, could be 200, 500 male dentists, and I'd be the only female. So that was clearly different for me. I knew nobody. I knew no female dentist at all who had babies, and I had a baby 2 years into practice. I had my solo practice and a baby. Oh my gosh, figure that one out. So that was a challenge. I had no role models. I'm sorry, you were asking me what was the second part of it? Yes.
So you felt like
I never in school, I never felt discriminated against. And I think maybe you were getting at that a little bit. Like I did, I just felt like I was one of the guys. And I held myself that way. There were many of the women in our class who felt discriminated against. I never, ever felt, not even 1 second, that way. I just did what I needed to do, and I got out of there, and I felt great about my dental school experience. But many of my male colleagues from who graduated with me would not have had that same experience either. So I felt like my experience was a wonderful one. I have no negative memories of dental school whatsoever, except the hard work and the long hours, but I worked my way through, so that was made it even tougher. So
and now almost half the graduates are women.
Yeah.
And do you think that changes dentistry in any way?
I do. It creates more flexibility. I think that we have a different. The studies also were done by the American Dental Association years ago, talking about the different approach of female dentists versus male dentists. And my experience has been that most people who have come to me for the first time, they've come to a female dentist, they don't ever want to go to a male dentist after they've experienced a female. Now, that is probably because most of my patients are much more heavily female and fearful. So if you want to practice seriously phobic patients, become a female dentist, Howard.
Yeah,
Okay.
I
They
personally,
and I love them. They are my favorite people because they have the most serious and most challenging dental problems and systemic problems of anybody. So they are my favorite patients, the severely phobic. And I use no sedation except natural nutrients for sedation. That's all I do. I use
and
no.
what are your natural
I
nutrients
do
for
full
sedation?
mouth, I do full mouth extractions.
With what?
So, uh,
What is your natural sedation?
well, actually, I would recommend New Calmed as a
Right,
start
Newcom.
for people. It certainly absolutely works.
Who's the CEO of that? He's my buddy. What's his name?
I can't think of his name right now either. I'm so sorry. But yes, so definitely that. And then also after New Calm, I I get my supplements from a particular company, and you have to. That actually was started by a dentist and a chiropractor, her husband, Dr. Bob Walker and Dr. Kay MacArthur. And she's a dentist from Australia, and they both retired their practices in order to teach dentists about integrative medicine. And they are absolutely the most brilliant people I have ever heard speak on anything related to medicine and integrative medicine. And they would be phenomenal if you could get them on your podcast. Absolutely phenomenal. Kay has a strong Australian accent or New Zealand accent.
What's her name?
Kaye MacArthur, MacArthur, and he is Dr. Bob Walker. And Bob actually he developed some of the very early.
John MacArthur?
Bob.
Oh, Bob.
Robert Walker.
And Robert
Bob Walker.
Well,
Bob
can you email me their names?
I will. But their courses are exceptionaldentalcourses.com. exceptionaldentalcourses.com. And their nutritional products are exceptionalnutritionals.com. And I totally trust their product. They secured it for themselves. I'm not sure I was even supposed to say the name of it because you have to be a dentist trained either by me or by them. Now, let me tell you this, Howard, I want to be very clear. I have no disclosures to make because I do not receive any compensation from Bob and Kay or from their nutritional products or anything. I never have, and I have never even gotten free product for me. But I use them for me, I use them for my family, I use them for my patients, and we have developed a very simple protocol for periodontal disease patients, and it's something that I teach in my course, and it's just a slam dunk.
And I should disclose that I am sponsored by Oscar Mayer Wiener. That's why I made that hot dog ketchup mustard joke. But hey, I'm so proud of you the most because when you go through history, every 100 years, everything we know is crazy. If you want to do, what the craziest thought experiment you could do? I got on the internet a long time ago, and I bought the first 3 books written by G.V. Black. And he's the father of modern dentistry. And I have his first 3 books autographed and signed by him. I'm too embarrassed to tell you what I paid for them. And here's the father of modern dentistry. We just think G.V. Black is just the man. Yeah, go back and read what they thought a century ago, and then go back before him, go back to Pierre Fauchard in the 1700s and read his book. And when you read Pierre Fauchard, the father of dentistry out of Paris, France, and then you read G.V. Black out of America, and then you realize, man, this is 2016. What are they going to think 100 years from now? So all I want to do is end with, you know what you know, but you have no idea what you don't know. And stay humble, my friend. I want you to be happy, healthy, but stay humble, because if you ask any American, describe a physician, dentist, or lawyer. Of their first 10 adjectives, how many of those adjectives would say humble, open-minded? No. Arrogant, conceited, know-it-all, talks down, subjective. And you got to stay humble, my friend, because you just don't know what you don't know. And patients love holistic. Old, conservative male Republican dentists don't, and the consumer does, and the consumer does for the same reason the dentists are holistic and don't know it, is that I think America has rapidly lost faith with the prescription medication industry, where you go in and tell a doctor, I'm having a problem sleeping. Oh, here's Ambien. I'm sad. Oh, here's Prozac. Oh, I'm still sad. Oh, they just throw pills at you. And I think the dentists are the most group done with that model. And so they're just now awakening that, yeah, maybe I am holistic and I never knew it. And
I have so much for this younger generation of dentists. I'm so excited, and I look forward to having an opportunity soon to mentor someone in my practice. And so if there are any young dentists out there, and maybe even if I have preference to mentor a female dentist, I would be probably even more excited. But if there's anybody out there who is interested in being a part of what
post it on Dental Town. You got 217,000 dentists on Dental Town. Announce on Dental Town that you're looking for that you're going to mentor someone. You'd probably get I bet you would get 50 applications the first day.
Wow. Okay.
No, I mean, there's 250,000 dentists on there. I mean, God, that'd be 1/10 of 1%. You'd be overloaded. But I just want to tell you that it's a huge honor that you spent an hour today with me and my homies on Dentistry Uncensored. I thoroughly enjoyed it, and thank you so much for your time, Lisa, and I can't wait to see you soon.
Thank you, Howard. My pleasure.
And you can see her next go to aaosh.org, and that's going to be in August. And you can see her at my
September.
That's September. And
September.
Then you can see her at my buddy Sean Keating's in California. That's and when's that?
That is November the 18th and 19th, but also we are also going to do kind of a road trip and we're hoping to fill Houston, and which we've never been to Texas. So Houston has a big calling for us right now, and Portland and Seattle. So if there's anybody out there that's interested.
Is Sean promoting all those?
No, nobody's promoting, no.
But those are separate gigs? I just want to give you
separate gigs. And they will probably also be lined up in November.
I just want to give you, have you ever lectured for Sean before?
No.
Yeah, I just want to give you one warning. He picks you up at the airport and he takes you out to dinner, and you'll just be too hungover to lecture the next day. So just be careful. Be careful. He's a big Italian food with a big bottle of wine, and then the second bottle of wine. So what's your wine consumption with Sean, or you'll oversleep the seminar. But hey, Lisa Marie, thank you so much. That was Lisa Marie Samaha. Thanks again.
Thanks, Howard. Bye-bye.
Bye-bye.